Welcome to Crossroads Podcast, real conversations about mental health in the MENA region. I'm Reece Lavender, clinical psychologist practicing at Mahdi Psychology Center in Cairo and in Dubai. In each episode, I sit down with professionals to discuss how culture, care, and psychology intersect in our daily lives. Whether you're a parent, student, doctor, or just curious, these conversations are for you. Dr. Heba Al Kassass, welcome to Crossroads. We are having conversations about how culture and psychology meet. And so, Heba, you are a physician and you're also a breast imaging consultant. So your specialism is in breast cancer. So you are diagnosing breast cancer every day. So you witness firsthand the emotional toll. I see in my practice, that women are often dealing with these diagnoses in silence. There's a lot of fear. There's a lot of taboo and stigma in this culture around body image, diagnoses like breast cancer. I'd like to hear what you observe. What do you witness in your practice?
Hi, hello first. Thank you for having me today with you. As you just said, that being the imaging professional, I'm the first one to witness the emotional toll with the patient when she's diagnosed with breast cancer. Immediately when a mammogram reveals a suspicious lesion, it immediately alters the emotional state of the patient. It's sometimes emotional numbness, fear, denial. In Egypt, a lot of women, especially in the underserved area, they provide the house. So she's always scared if she gets sick, who's gonna spend on her kids. There's also the social stigma that she would be labeled from her in-laws, from her husband. I see a lot of women, they get abandoned by their husbands when they get diagnosed by breast cancer. Yes, and I'm not a family member, but I'm the first. I can see how compassionate and being compassionate with her and empathy immediately reduces her fear and it makes her more comfortable. So it's very important for mental health to be addressed with these patients. Especially in underserviced areas, because they are usually they are scared to express their symptoms or to say that they are suffering from that, which makes them very delayed in the diagnosis and sometimes leads to mastectomy, because now in Egypt it's very advanced, the treatment the management options for breast cancer. So when she's diagnosed early, she can preserve her breast and just have a small lumpectomy. But because of the social taboo, as you said, about talking changes in her breast, and she's not allowed to talk freely about it, makes it come at a very advanced stage and leads to a mastectomy. And consequently, the social status of her changes. Her husband will not accept her, and he will leave her and divorce her. He will body shame her and stuff like that.
And I was reading in the research literature that 60% of diagnoses in breast cancer in women in this country occur in late stages.
Exactly, because as you said, it's a social stigma and it's taboo. The woman, she would know she had something, but she would be very, very ashamed to talk about it, because she would be body shamed, as I told you, from her sisters, her mother-in-law, especially her husband, stuff like that. So she decided to stay, hoping that it will just go away. Yes. Especially in the underserved area, it's called cancer is called the bad disease. They call it the bad disease. Sometimes people are scared from her that she's contagious.
Oh, really?
Yes.
Gosh. So Heba, I think it brings to mind a really important question for me is, how could someone like me as a clinical psychologist, how could I support your work where you are seeing that emotional toll playing out in front of you?
I see that integrating mental health in breast cancer patients is not a luxury, it's a necessity. I've seen it with my own eyes, how a patient would come with a recurrence because her husband divorced her. On the other hand, I know the first year, Bahia, it's the biggest hospital for breast cancer patients in Egypt. It's an NGO. I remember very well, she was a Syrian girl. She was 22 years old and she was engaged and her wedding was in a month. She felt a lump, and when she came to me, to Bahia, and it was breast cancer, she started to cry and got very emotional. And she asked her fiancé to leave her. She told him, "We're still not married, please leave me, I'm gonna die." He refused. She came a month later for the PET scan, for the body scan, and she had metastasis in the liver, and she was devastated. And his mother asked him to leave her. She was like, "Yes, you are being very unfair to my son." And I told her, "Why are you saying this?" She's asking him to leave her. The boy refused, and they got married. And 10 years later, they were just visiting me a week ago, and she's still alive, although she has metastasis. On the other hand, a patient will come with a very small lump, but her husband will not accept this, so he divorces her. She come a year later with a recurrence in both breasts. So it's
So
really not a luxury, it's a necessity.
Yeah.
For sure.
Yes. I guess psychoeducation, education around all of this is really an important part of your work too. How does it differ, in the different populations that you serve? I guess you're providing more education to
the underserved areas.
Yes.
We give lectures. We go there, provide the car. Now we have the trucks, the movable trucks.
Yes,
We go to the rural areas. We encourage women to get screened, and because we even educate them to talk about their body changes. If she feels any changes in her breast, she should speak, because early detection would make a huge difference in the outcome of the management. So that's what we're trying to do.
Now, I didn't mention at the outset another important hat that you wear, and that is that of professor at Cairo University.
Yes.
How do you, when you're teaching, students that are working with you, student doctors?
I teach them to treat the patient, not the disease.
Treat the patient, not the disease. Isn't that important?
It's very important.
Yeah. So not just the symptom.
Exactly.
Yeah.
She's a human being.
She's a human being. So are you often met with surprise, from your students when they hear you say this?
I think they love me because of that, because they see how I'm compassionate with the patients. I never get fed up. I listen to them all the time. I answer all the questions, all their concerns, because they are scared to talk to other people. So when they find someone really having the ears and listening to them, they can ask millions of questions. But I just believe it's the right, and makes a huge difference.
Now, I've known you for a few years, and I know that that's one of your hallmarks of your work, right? And also your reputation as a doctor is just that humanistic approach that you have with your patients, the empathy, right? So the self-care that you rely on as a physician, as a specialist in breast cancer, is to be able to talk to someone about, the emotions that you face.
Inside.
Yeah. Is this something that you talk to student doctors about, or your colleagues?
What do you mean?
Just to the importance of having a therapeutic space.
I always I say that it made a huge difference to me.
Yeah. And if we think back to the patients that you work with and the impact of breast cancer on their mental health, what do you see in the reverse? What stories do you often hear of something really difficult or traumatic that maybe one of your patients has been through, that you can then link back to the development of breast cancer?
A patient she was just with me. I was just telling you about her yesterday. She came with a recurrence. That's her third recurrence.
Wow.
Because her first husband, when she was diagnosed with breast cancer, he decided that he cannot deal with her. She's not infatuating anymore. He just can't deal with her with this mastectomy. He left her. She got a recurrence at the operative bed 2 years later, and then she met someone, and he wasn't very supportive. She got the third recurrence.
So you see in your work a direct link between the development of breast cancer.
And I see the effect when the husband is supportive and the mother is supportive, how it makes a huge difference. A lot of men send their wives to their mothers until they get treated.
Is that right?
Yes, he says, I can't take care of you.
So in the underserviced population that you work with, because I know that you do a lot of outreach as well, you also work in a public hospital. When they don't have access to mental health services,
I try to be the
psychologist. You try to provide that service.
So I believe very much that breast cancer, it hits the soul before the body. So
wow, that's really really important, isn't it?
It's very, very important.
Yeah.
So I try to be there for them as much as I can.
Do you feel that we need to do better at promoting this in this part of the world?
Definitely.
What
I
do you
believe
think?
that every breast cancer institute should have mental health. Mental health should be integrated with the breast cancer institutes. It's as important as the oncologist, as the oncosurgeons, the radiologists. It's very important.
And when there's either a reluctance to even consider that, what do you do? You know, like say in a
It's usually, as you said, it could be, again, it's a taboo to be going to a psychologist. Means she's crazy or something. We try to educate women as much as we can that it's affecting you. It's you don't want to express it. You're hiding it. You're denying it, but it is there, and it will make a difference to you. One of the causing factors of breast cancer is depression and is anxiety. So yes. So it definitely affects the body, changes in the cells replication, stuff like that. So it's important. I always teach them that. I tell them it's one of the causes. And I usually try to hint it in a hidden way. Were you upset recently? Or she said, oh, you must not be upset. You must work on your mental status. It will get better. That's important, stuff like that.
I mean, there is a famous adage, you know, that says that the body keeps the score.
Yes.
You know, and, you know, we do see in our bodies what is the manifestation of deep-seated emotion, right? With that in mind, you know, in the different hats that you do wear, private practice, public practice, but also as an educator in your role at the university, what challenges do you face, you know, with the way you see the interaction?
Usually the underserved areas, because they feel they can get sick. Women feel they are responsible for the house, for the spending, for their kids, for even their husbands, because most of men in these underserved areas, they don't work. They rely on the women. So she feels it's not her right to get sick. So when I tell her, no, I'm not going to do anything, I'm just going to leave.
So there's very little respite for them. Yeah.
Yes.
You know, if we consider your work and what I do as a clinical psychologist, I mean, obviously, you know, I also work in private practice. There's a huge connection that I see, you know, just in everyday life, you know, in everyday presentations that clients come to see me about, you know, the influence of emotion over, you know, health conditions, you know, whether it be heart conditions or the development of cancer, high blood pressure, things like that. Do you think that there's ways that, you know, that the layperson, you know, just people in the general population can also start conversations about this? How would you recommend?
I think it should be integrated in the screening program when we go and give lectures about breast cancer screening and the importance. Part of it should be that if a woman, if you get diagnosed with breast cancer, you should seek psychological help because it's gonna 100% affect your outcome.
Do you see a chance of that happening very soon in where you work?
Yes. I think now women are more educated. Even now, I've been working in this for 17 years. Even now, when I was just coming from the public hospital, women are more aware and they speak more freely about the changes in their breasts. They don't really care about the social stigma. I think it's going in the right way. I can see it happening, yes.
Wonderful to hear.
I'm hopeful.
So Heba, I'm wondering if you could share with the audience, some preventative tips. What should women be looking for, and when should they go and get checked?
Okay, it's not a preventative tip as much as it's a screening tip.
Screening, yes.
So every woman starting the age of 25 should have a monthly self-examination. The brochures are everywhere online. She can, there are two, while lying down and standing up. And starting the age of 40, she should have a regular mammogram every year. It's very, very, very important. It reduces the, when patient get diagnosed in an early stage, they are 99% 100% healed. It doesn't recur because we diagnose it in a very, very early stage called a carcinoma in situ. It's stage 0. So even in the States now, they're considering not doing surgery to these patients, just radiotherapy, but in Egypt we're still scared, so we do lumpectomy and radiotherapy. We usually start at the age of 40, but if the patient is coming from a family with a strong family history, her mother, her aunt, her sister has breast cancer, she can start earlier, 10 years younger than the youngest family member got breast cancer.
Oh.
So if her sister, for example, got breast cancer at the age of 40, she should start screening at the age of 30.
Okay,
but really not less than 25. We don't start before 25.
Okay.
She should notice every month that if there are any changes, like the changes in breast size, if the nipple is inverted, changes in the skin color or the skin texture, if she feels a lump, all these, she should seek medical help immediately.
So what would your message be to women about, proactive health and their emotions that come with it?
Ladies, your health does matter.
your health
Early
needs.
detection is your best protection, definitely.
Early,
Detection is your best protection.
amazing. Dr. Heba Al Kassass, thank you for joining me on Crossroads. It's been a pleasure to have you.
Same here. Thank
And
you.
hope to see you again soon.
Soon.
Thank you for joining Crossroads podcast. If any of these conversations resonated with you, please share them with someone who might need them. If you need therapeutic support, I offer clinical services at Mahdi Psychology Center in Cairo and Dubai. You can find more details in the show notes, and see you next week.